Welcome to another episode of our podcast, Smile is in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today with me I have Dr. Reena Wadia. So, Rina qualified from Barts and The London with the Precision Gold Medal. Today, she is a renowned figure of authority across the global dental industry and is the principal periodontist and founder of ReWV Perio, the leading clinic for periodontal health, located on the 75 Harley Street. Dedicated for acquiring and building new knowledge, Dr. Rina is well known in her fields and in the media for encouraging and supporting other dental professionals by sharing and in learning and experience. To this end, she created her own blog and set up Perio School, a global teaching academy. So, welcome, Rina.
Thank you so much for having me.
Thank you for being here also. So, I know that you also have a podcast that
Yes.
we just talked a little bit before, Life and Smile. That's the name of the podcast. Why do you like to share so much your knowledge?
So Life and Smile, I launched this around a year ago, so in February last year, and it's definitely been one of my favorite projects so far. Actually, Life and Smile is more than dental, so it's dental, business, and lifestyle, and I really wanted to incorporate that 360 conversation. So we've actually just launched season 3, and it's on Spotify, so please do check it out. But it's really good fun because you get to create sort of in-depth conversation with someone who's at the top of their field. So we interview experts from all different specialties, not just dental, but from anything from music to sports to fashion. And you really get the behind the scenes of their life, what their career pointing turns are, what they can't live without, what's made them successful, what challenges they've had. Because I think everyone really wants to know that behind the scenes of what's actually going on. So it's really exciting. Everyone's found it really useful so far. Some of the guests have included people like Sarah Harris from Vogue. We've had Rishi from MasterChef, Harps from BBC. So it's a very varied kind of conversation. I've learned so much from it. And I just love sharing what I learn. So as you mentioned, when I first set up my blog, many years ago, I used to attend dental lectures and make some notes. And before blogging was even a thing, I was putting it online and people think, what are you doing? But I loved sharing that because people, I think it's enjoyable to share your knowledge and you learn from each other. I think it's really important. So I think Life and Smile is a version of that, but taking it 360 business and lifestyle as well. So it's been really good fun.
I like the concept because we are these crazy guys that's always expose the wins and failures. And when we have the failures, we always have someone that come to you and say, okay, I solve it this way. Maybe it can be helpful for you.
Yes.
Oh, really? You have this win. How you did it? So can you share with me?
Exactly.
And that's what you are doing, not only with the blog, with the podcast, but also with your academy.
Yes.
Why this adventure with the Perio School?
Yeah, Perio School was born officially during the COVID lockdown, actually. So what happened was during the first lockdown in the UK, as I'm sure across the world, we couldn't work. So I had so many hands-on courses lined up. And I was thinking, oh no, I'm not going to be able to carry out these courses. There must be another way. And I think in times of challenges, you really have to pivot. You have to be able to think about, okay, how can I make this work? How can I share the information with the rest of the world? So then I thought, actually, why don't I build a digital platform where I can share everything I was going to share, but in a video version, an online version. So I spent like a good amount of time writing the courses, filming the courses, and then we launched 2 key courses. It was the hygienist course online and the essentials of Perio, which was one of our first online courses. And I was really surprised with the amount of people who really wanted to learn about Perio and were keen, and they had a massive thirst for education. So initially I was just doing it for the people who had already booked on the course, but it became hugely successful, thankfully. And since then, I've now been launching many more online courses. But now we also have tied on the hands-on courses as part of the Perio School umbrella. So the hands-on I've been doing for over a decade, but I've brought it under the Perio School umbrella. So We have weekend courses that we do for hygienists, for dentists, surgical courses. But probably the most exciting thing last year was our diploma in perio. So we trained 36 dental professionals to have a PG dip in perio, which is accredited and recognized across the world. So that's been super exciting with our new training facility in Harley Street. So I think learning also makes the teacher learn more as well, because you've really got to know your stuff and you learn things from each other. So it's a great environment. I think sometimes dentistry can be a little bit lonely if you're going into work and just seeing your patients and coming home. So I think it's actually super important to network with your colleagues, support each other and learn from each other. So it's Perio School has been a great platform for that.
No, bravo for that, because you were doing this school, you were mounting a clinic from scratch also.
Yes.
I was able to follow a little bit of everything that was going on, and but you managed quite well. But don't you think that by focusing only in perio, you were losing a part of dentistry? And this is just mounting up because I have another question about it.
Sure. The answer is no. I mean, there are people who want to do everything, which is totally fine. For me, as soon as I kind of was coming to the end of my dentistry degree, I knew I wanted to specialize and focused on one thing, doing it really, really well. So for me, perio was like a no-brainer. I absolutely loved it. And the thing is, with perio, it's not just you're treating gums, but you're treating the whole person. It's holistic care now. So you're getting involved with risk factors, with diabetes. In fact, we've actually just invested in a HbA1c test at our clinic. So every patient gets HbA1c test so we can screen for diabetes. So you're looking, I think perio sometimes is a misconception. You're just debriding pockets, but it's more than that. And you can have a big impact. So I've always loved perio. And I think for me, it's also the surgery side of things. So I love mucogingival surgery, aesthetic surgery, which there's a big demand for now. So yes, you're focusing on perio, but then you also have to work with your colleagues. So your restorative dentists, other colleagues, therapists, I think it's important to work together if you are going to focus on one field.
That was exactly the answer that I was looking for. Why? Because since last year, I have the feeling that all these perio congress, they are more focused more and more in surgery.
Yes.
And for example, Europerio, it was really focused on implants. And where is the save your teeth? Again, and you are practicing this save your teeth. Do you think that periodontology need to be reminded of the basic?
I think that is the most important thing in terms of your teeth are nothing. Nothing beats your teeth, and all the studies show that as well. So I think the focus should be prevention, and then trying to maintain teeth and trying to maintain a comfortable mouth for your patient. So I agree. I think the surgery side is also important, but now I would say more so I'm doing more of it for the aesthetic side of things. So there's a lot of patient demands for what we call gum tweakments. So we do a lot of like crown lengthening for gummy smiles. Patients call it a gum lift, which I find really funny. And then also recession coverage. So there is a kind of, place for that for sure. But from the periodontitis point of view, there is a big scope for prevention and then minimally invasive sort of non-surgical treatment. And I think linking also that with general health as well is really important because patients are asking about it. We get patients at the clinic who come in saying, I read something in the newspaper that if I have bleeding gums, I might get, heart disease or diabetes. Please, can you check my gums? So there is a real, patients are very, very educated now and they expect us to know. So I think the least we should be doing is talking to them about that. And I say on my courses, people always say, my patient's not motivated to treat their perio. So I'll always ask them, what conversation are you having with them? Are you talking about the links between general health? Because when you do, they do start to care about their gums. So I think that communication side is key.
We talk offline that the patient, they have the information. Okay, they have too many information. And we as clinicians, we need to guide them, like to find out this is the good one for you, this is not really concerning you. And so we are educators. In a while. So if we talk with them, they will understand and we will prevent. And that's what we are focusing your practice. You are focusing prevention and even the work that you are doing in the mouth of the patient, you want to keep them in good shape.
Exactly.
So you have now, 4 or 5 dental hygienists?
Yeah, so we've got a big team now. So we've got 5 hygienists and 3 periodontists. And we do everything perio. And there's a big element of supportive care as well. So as you said, even once they're healthy and stable, the maintenance protocol has to be super strict. Otherwise, they're going to relapse again. So getting patients into the mindset that I'm going to need to maintain this long term is really important. It's like when you go to the gym, there's no point doing one workout and then just, you're in shape.
Exactly.
But if you don't keep doing it, you're not going to maintain it. So there's a whole mindset shift related to that. So yeah, we've got a big team now. I remember 5-6 years ago when I started, it was just me. And now we've got like 18 people, which is, it's a great team effort.
Yeah, I had the pleasure to meet some of them. I met Varka, I met also Devan,
Yeah.
and they are really nice people. Why? Because they talk the same language I do. Maybe that's why. But they really want to focus on the prevention, focus how to do non-surgical periodontal treatment. And in your school, you are teaching GBT today, right? So how is this feedback from the participants? Why you included GBT also in your plan?
Yeah, so we have, for all of our hands-on teaching, we always have the airflow and the piezo and the master, everything there, which all the delegates love. And initially, they've either heard about it or they've tried a little bit, but they haven't been trained on it. So we do, half a day's worth of training, and then they have to convince their dentist boss to buy one. But as soon as they do, they end up buying like one for every surgery. So we incorporate the airflow as part of our protocol, and it works beautifully, and patients ask for it now. So I think gone are the days where you're using like a rubber cup and Profi. It's kind of, we've moved on from there. So but I love it. We use the plus powder predominantly, and it's worked beautifully.
Oh, this is amazing. Big question now. Because you have the academy, because you have a practice center on Perio, because you are so focused in keep the health of your patients, how do you see the future of the modern dentistry?
Well, I think it's going to be prevention-based for sure, which is a key focus right now. I definitely think the whole kind of buzzword and the key hot topic right now is personalized medicine. So everything is very personalized and bespoke to your patient. So when your patient comes in, think of specific oral hygiene techniques, specific ways you're going to manage them, how you're going to do their appointments. It's very much based on them as an individual. So I think you have to tailor. Whereas 10 years ago, it's like everyone normal, you get the same oral hygiene for every patient, the same type of treatment, but now you've really got to tailor it. So personalized medicine is key. I also think multidisciplinary work, as we mentioned.
Yeah.
I really think that dentistry, and we need to put the mouth back into the body as such. It's a part of medicine. So, working with, as you said, when you're focused on perio, you have to work with restorative dentists, other dentists, etc. But and hygienists and therapists. But what about the medical team? Should we be working with diabetes specialists? Should we be working with other specialists? So I think multidisciplinary teams is going to be really important. And then also, I guess, the future is probably going to be super high tech as well.
Yeah.
So where EMS fits beautifully into that. So I think using the right equipment, minimally invasive treatment, even with surgery now, the equipment you're using and the blades you're using, everything is microsurgery and minimally invasive. And I say to our patients, even once they've had surgery, most of our patients, they need painkillers for like a day and then they're fine. It's minimal disruption to their daily lifestyle. Sometimes when I mention surgery, people get very worried, but it's actually not that bad. So it's just a scary word for something which you do something slightly different. So I think the future is going to be, building, and this is our focus at the clinic, building gum health as part of your lifestyle, and making sure you have a preventive first approach.
I like that approach. We don't treat teeth. We treat people with teeth.
For
so
sure.
We need to see the general.
And gums.
Gums. You cannot forget that. No, actually, Rina, I think you are the face of the modern dentistry. I'm interviewing a lot of people, and what I see is that this is being run by women today, and I'm fine with it. I have 2 little girls, so I'm fine with it completely. But what we see is that maybe this female side brought more importance for the general health and not just open mouth, let's do the work and it's done. And don't complain at the end. And it's more like, okay, no, let's understand what is going on. Let's try to do something minimally invasive. Let's try to check this and put it in place in time. It's not just get fixed one tooth and then forget about it. No,
Yes.
come frequently. I use a lot the analogy of the gym, actually.
Yes.
So I completely understand. We are in
Yeah.
the continuous model care,
For sure.
and I think you are putting that in place.
Thank you. No, I think it is a mindset shift. But it's, as you said, the other analogy, which I quite like, is when you have a car, you've got to get it serviced. Otherwise, it breaks down and it's even more expensive to repair. So, and when patients have implants, I say to them, you've now invested in a Ferrari. So you've really got to look after it, because sometimes they think I'm having an implant. It's fine. It's just a screw. But that needs maintenance as well. So, yeah, I think don't underestimate how much patients get it when you communicate with them properly.
Yeah.
Even simple things like showing them in the mirror, where the gum line is, why you're brushing in a certain way, going through that with them, and they really appreciate it. And they kind of, us as healthcare professionals, they expect us to give advice, not just on dental, but things like smoking cessation, diabetes advice. We should see it as kind of holistic care.
No, amazing. I need to visit your practice. I need to visit
You're welcome anytime.
Academy. I already promised that we will have the training kids there for sure. Rina, a big thank you for coming. Big thank you for sharing all of this, like how you put in place your academy, why you put in place your academy, treating people as people and not just the teeth and gums.
Yeah.
And really this vision about the modern dentistry, that I think you are in the right path. If people say no, they're not wrong. Okay?
I think the other point on that, just to add, is having that team approach is really important. So if there's just one clinician in the practice trying to push it, it doesn't usually work as well as if you can get your whole team on board. So I've been very lucky with Dr. Deva and Dr. Valka, the hygienists. Get the whole team involved, get the nurses involved. All of our nurses pretty much go on to be hygienists because they're so inspired by what Perio can actually do.
Nice.
So I would say to everyone out there, get involved get your whole team on board, because that will really help. And then everyone is singing from the same hymn book. Even the reception, front of house, they should be saying to your patients, how did it go? Did you love the airflow, etc.? And they should be saying, I've had it as well, and it's great. So I think, team approach is key.
I completely agree. If we work alone, we don't go anywhere.
No.
And you said today that the work of a dentist or a dental hygienist is so lonely sometimes.
Yes, it can be, yeah.
Yeah, even if we see a lot of people, we don't talk with them.
Yeah. Yeah.
So work as a team, and you're going to accomplish a lot of good things. So Rina, once again, thank you so much.
Thanks for having me.
And for the listeners, you hear it here by Rina. Teamwork makes the dream. And don't miss the next episode. So subscribe in every platform that you are seeing our podcast or listening to our podcast. And don't miss the next ones. Thank you. Thank you, Rina.
Thanks for having me.